This tutorial covers how to submit 2025 data in our online data portal to achieve a 2026 Achievement Award for the American Heart Association's Outpace CVD programs, Target BP, Check Change Control Cholesterol, and Target Type 2 Diabetes. Log into the data platform at aha.infosarioregistry.com/login using the username and password sent to you via email after registering. This slide contains further details on how to register your organization and get a user account. Before submitting your data, we recommend having the data collection worksheets available or filling them out ahead of time for ease. You can find them, along with other helpful resources, both in the library to the left and on our website at heart.org/outpacecvd platform. The worksheets contain additional guidance on how to answer each question, including the measure specifications and helpful guidance on the patient breakdown by their primary payer. To submit your data, you will use program forms. Click either the icon under Get Started or the link in the left navigation panel. If your organization has submitted in the past, you may have existing forms under the Edit Forms section, like I do here. Each date represents the calendar year from which that data was collected. For 2026 awards, you'll need to submit a 2025 form. You or another member of your organization may have already started entering your 2025 data for recognition, so check if you already have a 2025 program form for the programs you are participating in. If so, you can click that and start adding data. I'll be showing a walkthrough of our Target BP data submission process and then provide a comparison to the data submission processes for Check Change Control Cholesterol and Target Type 2 Diabetes. I don't have a program form started for Target BP yet, so I'm going to click Add New next to Target BP. I'm submitting data for a 2026 award, which is based on 2025 data. So I'll type 2025 into the reporting year field and hit Submit to start the form. Target BP has 3 tabs of data to enter, which you can see under tabs on the right. All fields must be completed to be eligible for an award. The first tab, Facility Information, contains questions about your healthcare organization and includes the measure denominator and numerator questions that will determine your recognition status. The second and third tabs ask the data submitter to attest if the organization has completed specific evidence-based blood pressure activities by the end of 2025. You can save or save and exit and come back at any time to revise your data. However, once all fields are complete and no errors are detected, go back to the Facility Information tab where the Data Entry Complete checkbox becomes available. Check this box and then save and exit to complete your submission. A snapshot of all data in the platform, complete or incomplete, is taken at the date and time of the recognition deadline, but you can revise your data at any point up until the snapshot time. Let's start entering our data. Before you begin, make sure the data you submit is representative of the healthcare organization you're currently viewing. Look left under Currently Viewing or the top right to orient yourself. In addition to the data collection worksheet highlighted earlier, you can also use the MIPS 236 measure specifications, which can be opened directly from the program form by clicking Measure Description link, Controlling High Blood Pressure. The first question asks if your organization, as represented by this facility in the platform, diagnoses and manages patients with hypertension, up to and including prescribing medications. A yes response is required to be eligible for a 2026 award. The second question requires you to certify that the attestations entered in the form are accurate to the best of your knowledge. A yes response is also required here to be eligible for a 2026 award. Question 3 asks for the total adult patient population ages 18 years and older. We are looking for your outpatient population who had a visit in office or via telehealth in 2025 for your organization and who were seen by providers who diagnose and treat hypertension. Please exclude acute care visits from this total, as well as other visit types where blood pressure would not be taken or managed. When pulling data for this question, make sure you are saving this query and can further break down the patients included by category. Later questions ask you to break this patient total down by primary payer and race and ethnicity, and these breakdowns must add up to your question 3 total. Note, an identical question will appear for our other programs, check change control cholesterol, and target type 2 diabetes. My demo organization has 44,682 patients ages 18 years and older. Question 4 is the denominator of the controlling high blood pressure measure. Using MIPS 236 measure logic, of the patients ages 18 to 85 who had an encounter in 2025, how many had a diagnosis of essential hypertension starting before and continuing into or starting during the first 6 months of the measurement period of January 1st through December 31st, 2025. Make sure to exclude certain patients based on the measure requirements, such as those with end-stage renal disease or pregnancy during the measure. My demo facility had 22,165 patients who met this criteria. Question 5 is the numerator of the measure. Of the hypertensive patients already included in question 4, how many of them had their blood pressure under control at their most recent 2025 visit? Under control is considered a systolic blood pressure of less than 140 millimeters of mercury and a diastolic blood pressure less than 90 millimeters of mercury. We had 17,201 hypertensive patients whose blood pressure was under 140/90 in 2025. Questions 4 and 5 are used to calculate your organization's performance on the measure. There are a couple of questions that will only appear if certain conditions are met. We'll walk through those together now. The first that you might encounter is in question 4. If you have only 10 or fewer patients in the denominator, then question 4A will appear. We'll ask for context on why your denominator is small and, if applicable, why your overall patient population may be small. Examples may include unique characteristics of your patient demographics or location. The second conditional question is 5A. This will appear if your performance on the measure is at or above 90% rounded up. Please verify your data and, if accurate, provide details that may be contributing to your above average performance. If these questions appear, you will need to answer them in order to save your form. I'm going to go back and re-enter my demo organization's correct data. And now I will be able to save my form. For question 6, we are looking for context on your numerator data. Blood pressure readings from remote monitoring devices can be included in the numerator as long as they meet criteria specified in the data collection worksheet. We are interested in understanding if your organization's data includes remote BP readings. Any answer is okay and will not affect your award level. For question 7, input how many providers your healthcare organization has. We are looking for all clinicians, physicians, nurse practitioners, and physician assistants involved in diagnosing and treating hypertension in your outpatient organization. In question 8, we ask for a breakdown of how your total adult patient population ages 18 years and older self-identify by race and ethnicity. This question is based on Table 3B of the HRSA Uniform Data System reporting requirements for 2025 health center data. All fields must contain a value. Please enter a 0 where there are no patients. Note, an identical question will appear for our other programs. check change control cholesterol, and target type 2 diabetes. Here is the data that I have. The final three fields are inclusive of all patients who have either their race, ethnicity, or both unknown or undisclosed. If they have identified as Hispanic, Latino, Latina, or of Spanish origin, but not disclosed their race, place them in the first of these three final fields. If they have identified their race, but not as Hispanic, Latino, Latina, or of Spanish origin, place them here. And then finally, if you know neither their race nor ethnicity, place them in the final field. Once all of the fields are filled in, an automatic total of what you have entered populates in the gray box at the bottom. This box must equal your answer to question 3. For question 9, take your total adult patient population given in question 3 and break it down by the patient's primary payer. Not sure which groups your patients fall under? Use the guidance in the data collection worksheet. The last page gives guidance on payer groupings. Here is the data that I have. If you're still not sure on some patients' payer groups, put them under the other unknown category. Like in question 8, once all fields are filled in, an automatic total of what you have entered populates in the gray box at the bottom, which must equal your answer to question 3. If it does not, say I change my other patients from 421 to a 0, an error will appear at question 3. Because this is a red error, I won't be able to save my form. For red errors like this one, I can delete one of the fields that's contributing to my subtotal to make the error disappear, allowing me to save and come back later. That said, all fields must be completed to be eligible for an award. So in order to fully fix this, I must eventually fill in this blank so these totals align. Note, just as in the table above, an identical question appears in check change control cholesterol and target type 2 diabetes. Next up is the second tab, which we can find by either clicking the Next button at the bottom of the screen or the tabs icon on the right. The second and third tabs feature our evidence-based activities questions. There are 5 pillars with 6 sub-questions each. On the second tab, you will find the Measure Accurately, Act Rapidly, and Partner with Patients pillars. On the third tab, you will find the Self-Measured Blood Pressure and Equitable Health Outcomes pillars. Here are some tips. In the same way we're looking for 2025 data, we are looking for 2025 practices. Recurring activities such as staff training must have occurred at least once in 2025 to answer yes. One-time activities such as placing a positioning graphic next to all blood pressure device stations could have occurred before 2025 but needs to have been continued in 2025. Each unique question number corresponds to one of the 6 activities. Questions 10A and 10B together represent one activity, while question 11 alone represents one activity. With the exception of these 2 questions, all are yes, no, or not sure responses. For detailed support on these questions, please utilize the Evidence-Based Activities, Resources, and Examples Toolkit available on targetbp.org. I'll now select my answers on tab 2. First, for Measure Accurately. Next, for the Act Rapidly pillar. And then finally on this tab, for Partner with Patients. Now I'll go to the final tab by clicking Next. Here I'll select my answers to the last 2 sets of pillar questions. First, self-measured blood pressure. And then finally, equitable health outcomes. Once we have completed all of our questions, we will navigate back to the Facility Information tab on the right. The last step in our Target BP submission process is to check the Data Entry Complete box. An important note, if this checkbox cannot be populated, it means your data is incomplete and you may not be eligible for recognition. Please review all 3 tabs and ensure no fields are left unanswered before exiting. I am unable to check the box. Scrolling through my questions, I can see that it is because I left the other unknown field for question 9 blank. Now that is corrected, I am able to check the Data Entry Complete box, which ensures that I am ready for recognition. Finally, I'll click Save and Exit. Back under Program Forms, I now have a saved 2025 form for Target BP. You can go back and edit your data at any time before the data submission deadline. As long as your data is complete by that time, you are considered eligible for an Achievement Award. Now let's look at the Check Change Control Cholesterol Program form. You can see that I've already started the form, so I will click here to edit it. At a glance, you can see that the program form looks very similar to the Target BP program form. It begins with instructions, and then on the right are the tabs that house all of the program questions. While Target BP has 3 tabs of data to enter, Check Change Control Cholesterol has only 2. The first question asks if your organization diagnoses and manages adult patients with high cholesterol, up to and including prescribing and managing medications. A yes is required to be eligible for an award. You'll find the next 5 questions are identical to those asked in Target BP. I've already completed these answers. Questions 7 through 10 ask about your use of ASCVD risk estimation and treatment plans for very high-risk patients. Question 7 asks you to describe your organization's use of ASCVD risk calculators, utilizing either the Pooled Cohort Equations CV risk calculator or the PREVENT calculator as part of standard process. Please note that some of the answers conflict and will be hidden as other selections are chosen. My organization currently calculates ASCVD risk estimations in our EHR, so clicking this will hide the next option of calculating externally to the EHR. Likewise, we also collect the results in a discrete field within the EHR, which hides the next option of a notes field. Finally, I'll also select that the clinicians at my organization discuss the ASCVD risk estimation results with patients, since this is a priority for our organization. Question 8 asks if your organization operationalizes a specific treatment plan for managing patients considered very high risk for future ASCVD events. If you answer yes, we'll ask for more details about what that plan includes. Note that you must answer these follow-up questions. Leaving these unanswered generates a red critical error which will prevent you from saving your form. My organization's treatment plan includes the detailed collection of past medical history, a protocol for repeat lipid measurement, and educating care teams every 12 months. Question 9 asks if your organization is committed to continuously improving use and data capture of ASCVD risk estimations. You must answer yes to be eligible for an award. Selecting no generates a note that tells me I'm ineligible for an award. Question 10 asks about your use of the American Heart Association's PREVENT calculator, which aims to help clinicians implement risk assessment for cardiovascular disease and facilitate clinician-patient discussion to optimize prevention for cardiovascular disease, including ASCVD and heart failure. This tool factors in kidney disease and metabolic disease, including type 2 diabetes and obesity, as well as indicators of social deprivation. We ask you to describe your organization's familiarity and use of the PREVENT calculator. At my organization, some clinicians use the Prevent tool as a standalone tool, but it is not yet integrated into the EHR. The final questions are housed in the Measure Submission tab. This can be accessed by clicking the blue icon with 4 lines or the Next button at the bottom of the screen. The questions on the final tab are used to calculate your organization's performance on the measure and your subsequent award status. Please note, you must use the MIPS 438 measure criteria as specified. Using a different measure, using a custom definition of at-risk patients, or pulling in only patients with ASCVD is not acceptable for award eligibility. You can access the measure specifications from this link at the top of the page. Question 11 is the denominator of the MIPS 438 measure. This denominator asks for patients who had an office visit in 2025 and who are considered at high risk for cardiovascular events. Using MIPS 438 logic, how many patients fall into any of these 4 risk groups? Note that though it says "or" between each group, you are not picking a single group for your denominator. You are analyzing your patient population to determine all patients who fall into one or more of these risk groups. When calculating, you can determine how many patients are in each risk group and provide the sum of all 4, but be careful not to double count patients who fall into more than one risk group. Make sure to save this end result of patients so you can calculate your numerator. The risk group criteria are 1. All patients who were previously diagnosed with or currently have a diagnosis of clinical ASCVD, including an ASCVD procedure, or 2. Patients aged 20 to 75 years at the beginning of the performance period who have ever had a lab result of LDL-C greater than or equal to 190 milligrams per deciliter, or were previously diagnosed with or currently have an active diagnosis of familial hypercholesterolemia, or 3. Patients aged 40 to 75 years at the beginning of the performance period with type 1 or type 2 diabetes, or 4. Patients aged 40 to 75 years at the beginning of the performance period with a 10-year ASCVD risk score of greater than or equal to 20%. Make sure to exclude certain patients from all calculations based on the measure requirements, such as patients who are pregnant or breastfeeding. As with Target BP, if you enter 10 or less for the denominator, you will be asked for context on why your organization has a small denominator population. Question 12 is the numerator of the measure. Of the patients who fell into the denominator, question 11, how many were prescribed or were actively using statins in 2025? Again, as with Target BP, if your performance on the measure is above 90%, you will be asked to verify your data and, if accurate, provide details that may be contributing to your above average performance. Time to enter my answers to questions 11 and 12. My demo facility had 2,316 patients in the above risk groups. You can see that an additional question has appeared. This won't appear for everyone. It popped up for me because my answer represented less than 6% of my total patient population that I gave back in question 3. Because it's unusual for such a small segment of patients to be in any of these risk groups, we need to know a little bit more about how you pulled this data. Question 13 asks if you determined your risk group patients based on a sampling or a subset of patients rather than the full population. If yes, question 14 appears and asks for a brief description of your sampling method and reason for sampling. Make sure to include the initial population sampled, the sample size, and selection methods. If you did not sample, then question 15 appears instead. requesting that you double check the measure logic. Remember, the denominator represents patients in all of these 4 risk groups, not just one. If your query was correct, let us know why your organization's population may be unique. Please note, if these additional questions appear to be eligible for an award, you must either 1. Revise your denominator data to be more than 6% of your total population, or 2. You must answer all of the new questions to the best of your ability. For my demo organization, after double checking my measure logic, I realized I had incorrectly calculated one of the risk groups. My real denominator is 9,614. Finally, of my at-risk patients, 7,350 were prescribed or using statins. To complete my check change control cholesterol form, I will return to the participant information tab. I will check the data entry complete checkbox, which again ensures that I have completed all required fields, and then I'll hit save and exit. Last, let's look at the Target Type 2 Diabetes program form. You can see that I've already started the form, so I will click here to begin editing. At a glance, you can see that the program form is set up the same way as the previous 2 programs. We have instructions at the top, and to the right are our question tabs. Like Target BP, there are 3 tabs of data to enter for Target Type 2 Diabetes. The first question asks if your organization diagnoses and manages adult patients with diabetes, up to and including prescribing and managing medications. A yes is required to be eligible for an award. You'll find the next 5 questions are identical to those asked in Target BP and in Check Change Control Cholesterol. I've already completed these answers. I'll click Next to go to the second tab. The Clinical Practices tab asks about your organization's evidence-based activity efforts. This begins with a multi-select question on which guideline-directed treatment and prevention efforts your organization deploys for patients with prediabetes. Next, our questions are organized into 4 pillars with 6 sub-questions each: an assessment pillar, a treatment pillar, a patient partnership and lifestyle modifications pillar, and an equitable health outcomes pillar. As with Target BP, evidence-based activities questions are asked in a yes, no, not sure format where each question number represents one activity. On question 12, if you do select yes, that your standard of care includes the assessment and evaluation of comorbidities, then we want to know which comorbidities are being included. Please select all that apply in question 12A. For detailed support on these questions, please utilize the Evidence-Based Activities Resources and Examples Toolkit that is available on heart.org/Outpace CVD platform. I'll click Next to go to the final tab. The third tab houses our measure submission questions for Target Type 2 Diabetes. Question 32 is the denominator of the MIPS #1 measure, which is required for recognition. This denominator asks for patients who had a 2025 office visit and have been diagnosed with diabetes. Using the MIPS #1 measure, which again can be accessed via this link, how many patients met these criteria? As with the other 2 programs, if you have 10 or fewer patients in the denominator, you will be asked for more information. My demo organization had 10,875 patients with diabetes who had a 2025 office visit. Question 33 is the numerator of the measure. Of the patients with diabetes from question 32, what is the number of patients whose most recent glycemic status assessment, HbA1c or DMI, level performed during 2025 is greater than 9%, or who had no HbA1c level performed in 2025. Remember, the lower the numerator, the better the clinical performance. My demo organization had 2,046 patients meeting the numerator criteria. In other words, 2,046 patients who were poorly controlled. Questions 34 and 35, as well as 36 and 37, are optional, but you need to answer one of these question pairs for recognition. Questions 34 and 35 are the denominator and numerator of the MIPS 438 measure. These are identical to the questions we walked through in the Check Change Control Cholesterol Program Form section of this tutorial, questions 11 and 12. I'll choose to submit data for this measure. My demo organization had 9,614 patients meeting risk group criteria. Of those at-risk patients, 7,350 were prescribed or using statins. Questions 36 and 37 are the denominator and numerator of the MIPS 236 measure. These are identical to the questions we walked through in the Target BP program form section of this tutorial, questions 4 and 5. Remember, I can leave this blank only because I submitted data for the first of the 2 CVD measures. To complete your data submission, make sure you filled in both fields for the diabetes measure and both fields for one of the cardiovascular disease measures. Once all fields have been entered, I will return back to the Participant Information tab, and as I did with our other programs, I'll check the Data Entry Complete box, which ensures that I have completed all required fields, and finally hit Save and Exit. Back under Program Forms, you can see we now have 3 saved 2025 program forms. You can go back and edit your data at any time before the data submission deadline. As long as your data is complete by that time, you are considered eligible for an Achievement Award. Look out for regular newsletters and additional communications from the American Heart Association to learn more about recognition. Thank you for choosing to submit data for our Outpace CVD programs. If you have additional questions, please contact us at bit.ly/AQcontactus, or if you need help logging in, you can contact our platform vendor using the email address on screen now.